Today, the major focus of the webinar is to review the sample application and narrative response checklist. This will also have us going over some more documents that we have prepared for everyone to help support their narrative applications, but at the same time, just wanted to do a quick recap. Webinar 1, this was about our history and background and what staff and volunteer roles will be throughout the process, as well as we went over the process and highlighted some key dates to be paying attention to. Part 2 was doing a hands-on review of EC Impact, how to register a new organization, as well as how to get your programs ready to go for the application process for the organization and financial review information, and ultimately the eligibility determination. These webinars were recorded and will be available tomorrow, November 12th, by clicking the procedure and key dates files on the website. So today, though, as we talked about, we'll be going over the application and narrative response checklist, but to get us started, we do want to review the hierarchy of language and review the strategic investment plan. So the hierarchy of language, each issue area, our issue areas are, of course, basic needs, education, financial stability, and health. They each have a vision statement. These vision statements really help kind of encapsulate the work that they are trying to achieve within their areas. Under the vision statement, we have priorities. Priorities set out our overarching concepts for how we are going to achieve the vision. And then our strategies are specific to the priority and help us achieve the priority. So your job within the application is to draw the thread from your program to the strategy, to the priority, and ultimately the vision statement of the issue area. So the vision statement for health is activating and inspiring our community to get healthy and stay healthy. This means that regardless if you are a community health worker program or a mental health program, you must ensure that you have demonstrated how your program is helping to activate and inspire. So that is making sure that people are moving from the passenger seat to the driver's seat of their own health, and in times of stress can still take care of themselves and follow best practices. So we're going to do a little bit of an overview of the investment area. It is estimated that the funding provided to this issue area will be 18 to 22% of what is allocable. Now, one caveat to this is that we have introduced, as you know, a cross-issue area grant opportunity. This opportunity does not have a minimum or a maximum level. So that means that the volunteers will first be considering the cross-issue area grants. And if they have, say all of the vision councils have $1 million to allocate, and there are worthy $200,000 of worthy program investments to be made in cross-issue area, that means that that will come off the top, and then $800,000 will be redistributed based on these estimated funding ranges to the rest of the issue areas. Now, don't fear about not being able to write a cross-issue area grant or feeling like you have to apply under cross-issue area because they're being considered first. The vision councils themselves will be working to the goal is to establish the best investment portfolio to get us the greatest return on investment. So they're not going to negate effective programs in single issue areas just to fund things under cross issue area. They are going to look at what's working and what, again, has the greatest return, the potential for the greatest return on investment. So quickly, our priorities, we have 3 under health, 2 of which have been funded for 2 cycles now, and 1 which is now going to be being provided a one-time, not a one-time grant, but a grant for the first time in this cycle. So individuals are supported, connected, and activated to lead healthy lives. This is, again, of course, for all ages, and the portion of focus is 50 to 70% of the investment area. The second priority, individuals will have access to needed mental health services. Again, this is for all ages, and the portion of focus is 30 to 50%. The portion of focus is listed to show you if we had perfect applications come in and all of our priorities, this is how we estimate our funding to be distributed. It would fall within these ranges. Now, just because say we receive no mental health applications, they would not set aside 30 to 50% of funds and go seeking that out necessarily. They would invest what they can and what they should into the single priority area if necessary. Not that that's going to happen. United Way will advocate on behalf of health issues aligned with selected priorities and strategies. That's priority 3. This year, though, we have general advocacy, which is always unfunded. However, we are introducing a first-time opportunity to help us create a mental health and behavioral health system of care. This is not client-specific. This is program coordination, and actually will have its own application and all of its own support materials to go along with it. So there are some stipulations. Each issue area might have them. Health definitely does with 1. All programs, if applicable, will utilize the United Way Client Health Survey. If you are serving a population less than the age of 13, those clients will not partake in the Client Health Survey. But if you're serving individuals 13 and older, they will have to participate. Again, and also if you're applying for the System of Care grant, you would not have this client health survey. This data might be helpful for you, but since you are coordinating programs and agencies, you are not going to have to implement this with clients. So priority 1, individuals are supported, connected, and activated to lead healthy lives. There are 2 strategies under this priority. The first really points to establishing individuals in our community that will walk the walk and talk the talk with those who are at risk. And so to break this down, there are several methods that we name, and there are a plethora of others, so you can name your own, but providing peer navigation, community health worker services, and/or other methods. The next part is very critical. You have to demonstrate that these people are locating, activating, and supporting a targeted at-risk population. So again, you'll have to demonstrate how they're locating, activating, and supporting, and then you'll also be defining who that targeted at-risk population is. And then through the programming and the support, you need to be able to demonstrate that they are improving their access to care, their follow-through, their social determinants of health, and ultimately their health outcomes. So this is a pretty hefty strategy. The second strategy under this really focuses on synergistic centers of communities, what we call health champions or stakeholders. These are individuals who, with being provided knowledge and skills and resources, they can affect a target population that they interact with. We name specific examples of these 2 strategies within our request for application. And so if you're wondering whether or not this applies to you, please go try to find similarities within the programs that we've named in the request for application. Priority 2 is individuals will have access to needed mental health services. Needed is critical. This will be part of demonstrating or being successful in the application itself. You'll have to demonstrate how the mental health services you're providing are needed. The clientele that we're trying to target are at risk and underserved. So that means you need to, again, demonstrate how is the population you're serving at risk or underserved. And how is this helping to have access and increase engagement within these needed mental health services? So how is your service unique or positioning itself to be able to increase engagement of this needed mental health service? A new measurement that was added this year after our community conversation is looking at the average wait time for service. By tracking that, we hope to see that number go down, because what we found was, and we mentioned in the request for application, is that there's a severe need for acute mental health services or immediate mental health services in our community, and that it's leading to a lot of emergency room visits that could be taken care of if they had access to a counselor or to someone who could help them in that moment, rather than letting things persist. And then our third priority, which is now again being provided a single grant. So we hope to receive the opportunity to support one collaborative applicant in a perfect world that is going to help advance solutions to support mental health programs through the development of a community-wide system of care. And this is the mental health and behavioral health system of care. And you can read more about that within our request for application. So at this time, we are going to jump over to our United Way website. Excuse me for all of those. Okay, so here is the page where you will find all of the information you could possibly ever want for our upcoming process. How you get there, you can click News, Request for Applications, and then click here. Or we can search in the search box, Applications, and it'll be the first one available there as well. So we're going to scroll down to Health, and you can see here we have our survey tool that we mentioned under the issue area investment stipulations, and we also have our applications. Again, Priority 1 and Priority 2 will be funded under one application, and then Priority 3 is another application for the system of care. We're going to focus most of our attention on the Priority 1 and Priority 2 application, just because this will be where we receive a bulk of the applications to this issue area. So this application is available to you now. It will most likely not have major changes. There are a couple of changes that might be in the works regarding transportation and also adding an in-kind line here in the budget. However, those are going to be very small and would not really change how you're addressing these questions or disrupt any narrative writing that you are going to be able to do in advance of December 6th or 11th, because this won't change. So we hope that using this, you will start to form your narrative responses to these questions now. If you would like a Word application version of this, please feel free to reach out to myself or Mitch Baker. So with the application, we always provide a narrative response checklist. This is a tool that helps you formulate your responses. We as funders always provide loaded questions, and so rather than asking you, what could be 200 questions, 200 very small questions, we kind of lump them together. But we didn't want to leave you guessing as far as what the vision councils are going to be looking for within each of the responses. So you just want to go through narratively in your, you want to go through mentally in your mind and click and check off, have we explained what evidence supports this program? Have we connected the dots on how this is helping to activate and inspire our community to get healthy and stay healthy? This tool should be used in that way. And when we talk about drawing that thread from program to strategy to priority to vision statement, again, we've sat down and written these questions out to help really guide you in providing that narrative thread and also to be providing the best response possible to the issue area questions. We do have a very specific definition of what collaboration is. This is mentioned in several places and in several documents, also here in the narrative response checklist. If you have any questions about this definition, please do not hesitate to call myself or Mitch, because there are several definitions of collaborations out there. United Way, in order to make sure we are all talking the same language, have defined our own definition of collaboration as far as it goes in relationship with our grants. Depending on what kind of program you are, so if you're not sure if you're a pilot, a new program, or an existing program, you can go through and read about this criteria right here. And then the only other piece of information that you will be asked to provide is within the logic model data forms, a new narrative box will be provided under each measurement where you're going to have to define what evaluation tool are you using, who is evaluating that or using that tool, who is going to look at the data or information and how often, and also potentially what is success as far as outcome measurements go. Please take your time in filling this out. This is now scored this year. It was always a separate document in the past, but this is going to be embedded within your application and scored this year because we need programs to take this seriously, as this becomes a very good tool in the event of any type of programmatic turnover. And in almost every program that we have funded, there is some programmatic turnover that happens. It's a natural course of life, but at the same time, we want to make sure that United Way grants don't really have to skip a beat because we have these great tools in place to support you. In addition to the narrative response checklist, we do want to make sure that everyone has the same definitions as us when it comes to our budget. So here are our budget definitions that we hope you will utilize to complete your budget. We have a demographic step-by-step completion guide. This will help you formulate and double check your work to make sure that you are filling out this form correctly. If you follow the steps, there's no way that you can get it wrong. And then last but certainly not least, we have a scoring rubric. This scoring rubric will allow you to see what our Vision Council members are going to be looking for within those narrative responses in order to provide a good and just score. Just a reminder, our scoring scale is from 0 to 10, with 5 being effective. So 10 is a national model and most likely will be very hard to reach, with 0 failing to answer the questions. So 5 is effective. If you get a 50% on the application, that means that good job, your program is effective, you represented it clearly in the application. However, this is a very competitive process, and so as programs are able to demonstrate more effectiveness or have more evidence to support it, or are doing a better job of connecting and threading how they are aligning to the strategic investment plan, they might get higher scores. So we hope that you will do very well and use the narrative response checklist, but again, 5 is effective. And there are certain sections of the application that will only receive a 5. For example, a budget. So there is no way to have a national model of a budget. A budget is a budget is a budget. And so miscellaneous expenses and income, if they are not present and the budget makes sense and everything is complete and adequate and it makes sense to the narrative responses, then most likely you're getting a 5, but you can't get over a 5. But if you do have miscellaneous income or expenses, then you might get a 4, but it is ultimately up to the volunteers. Same with the demographics and your logic model. Anything dealing with numbers, if they are complete and adequate and make sense to the narrative that they have been reading, then most likely a 5 will be awarded. So a couple of helpful hints that we want to go over with you just to make sure that everyone has the opportunity to put their best foot forward. The application will allow you to have 90,000 characters of narrative responses to these questions. 90,000 characters is about 27 pages of narrative text. That does not include the formatting of the application itself. We really, truly hope that you do not use all 90,000, even though we are making it available to you. So if you're starting to run out of characters within a form, please, please, please come to one of our grant labs, which you can see here in the procedure and key dates file, which will also have the webinar links once they are all complete and uploaded tomorrow. The grant labs will take place every Thursday from 4 to 5 here at our United Way office. This will also mean that Mitch and I are available via phone, but you'll have a quiet place to work with some coffee, and we hope you will take that opportunity, especially if you are running out of characters, because we can help trim or suggest or give you prompts to help you condense the information that you are providing to us and really get to the root of what the volunteers are going to be looking for. Do not copy and paste would be the second tip. So if you are asked about a vision statement under the programmatic description and also under the issue area section, those are two, yes, you have to copy and paste the vision statement because your vision statement is your vision statement. But the way then that you frame it to that question is very different. So in program description, you're going to be using your vision statement to justify how your program and its elements align to your organization. And under the issue area, you're going to be using your vision statement to justify how your work and its program and its elements align to help achieve the vision and the priorities and the strategies of the issue area. Now, that should not be written the same way because those are two very different questions. The other piece of it is do not say refer to. So kind of like copying and pasting, but don't go back and say, well, if the issue area section asks for your vision statement in the narrative response checklist, don't say refer back to question yada yada in order to read our vision statement. Just write it down. Our volunteers go through multiple applications, and when they run into copying and pasting and they run into the refer tos, it gets very daunting as a volunteer to make it through those applications. And most likely, whether they wish it to or not, it will probably affect your score just because of human nature. And then last but certainly not least, our best tip we can offer you, aside from the grant labs, is to have someone who is not familiar with your program to read and score it to provide you feedback before you submit it to United Way. So I do this all the time with United Way. I love United Way. I think I know quite a bit about it. But when it comes time to articulate that in grants and to other people, I am arbitrarily filling in holes that might be important to be explained to the audience I'm talking to. And so that happens a lot in grant writing. And because you are writing, oh, well, this clinician is super critical to the work, but then you never explain why it's critical because you filled it in mentally. So a person who is not connected to your program will help you really filter out what needs to be explained. While our Vision Council members are experts, they are not necessarily experts in your programs, and so they won't have that ability to fill in the blanks or fill in the dots if they are not explicitly written. So at this time, that is all we have for webinar 3. Again, all of the rest of the webinars will be available tomorrow via the procedure and key dates documents on our website.